you so much for joining in for this cause. And today we are celebrating World Health Day. And we wanted to connect with you because we have been following your nonprofit's work and the impact that it has been creating. And we were really overwhelmed by this. So we wanted to talk to you in person and understand that how does your organization Datri works and what impact does it create. So let's start this conversation by introducing yourself and your organization Datri to all our audiences.
Okay, thank you Pratham, and thank you Goodera for giving us this opportunity. So to introduce myself, my name is Sumati Misra. I work with India's largest unrelated donor registry, and I will explain it further, called Datri. Datri has been in existence since 2009. We are an unrelated donor registry, which means that all our blood stem cell donors are not related to the patients they donate to. So if I explain in very layman terms, when someone has blood cancer or blood disorder like thalassemia, sickle cell anemia, ALL, aplastic anemia, these are diseases that we hear about. One of the curative measures is a bone marrow transplant. Right now, a bone marrow by virtue is in the thick bones of our body. So bone marrow is made. They are cells which can become anything in your blood. They can become red blood cells, they can become white blood cells, they can become platelets. So they are called mother cells, and they are made by us in our bones. So your hip bone and your pelvic girdle is actually where these cells are made. Okay, we've all seen some documentaries where a thick needle is put into your back and these cells are extracted. That is how bone marrow is actually extracted. Okay, but understanding that I'm donating to someone in need, known to me, I'm willing to go that extra bit. I'm willing to go get admitted to a hospital, and I will donate my bone marrow. But if I ask you to donate to someone who's not related to you, you will start questioning the whole methodology. Why should I get admitted to a hospital? Why should I get anesthesia? What if you take out some other organ of my body? These are normal things that we hear about. So as science progressed, doctors realized that your bone marrow cells are also available in your blood. So there's an overflow that happens from the thick bones into your blood. Okay, when we extract these cells from the blood, it is called blood stem cells. That is the difference. Okay, so blood stem cells is an outpatient procedure. It is very similar to platelet donation. It just takes about 3 to 4 hours of your life, but you can actually donate blood stem cells to a patient in need when you're matched with them. Okay, so India's largest registry is Datri. You need to register with Datri as a volunteer blood stem cell donor, the way you would register with a blood bank if you are a regular blood donor. Okay, so Datri has been in existence since 2009. Okay, we need registries because normally we don't get a test called an HLA test, which is needed to match a patient with a donor. Like when you do a blood transfusion, you only give blood which is matched. So if somebody is B positive, you will only give them either B positive or you will give them O positive blood, right? Similarly, when we match for bone marrow transplant or for blood stem cell transplant, we have to match HLA typing. HLA in normal terms is a protein that sits in your DNA. Okay, so all of us are related to each other. The point is, what is your match? Okay, we match 10 attributes in HLA. If you're a good match, it will be a 10 by 10 or it will be a 9 by 10. Anything less than a 9 by 10 is not taken for HLA matching in unrelated donors. If it is sibling or family donation, it could be taken as a 6 by 10 or a 7 by 10 also. Okay, so we at Datri create awareness. amongst people, saying that healthy people like you and me can be the cure for somebody who's fighting blood cancer or blood disorders. You only need to register with us, and once you are a match, you need to be willing to donate your blood stem cells. That is what Datri does. Now, coming to what I do, I handle the medical affairs in Datri. So once we get a request from a patient or a patient's doctor for a match, my team and I do the matching amongst our database. If we find a match, we convince the donor or counsel them to donate. We get the entire donation process done, and we transport the product to wherever the patient is being treated. 1 year post donation, if both parties are willing, then we share information with them on who the other person is. But for 1 year, it is silence. That's what we do.
That's so noble a cause, Sumati, and thank you so much. I think this topic is a lot of my interest as well. We can talk about that later, but currently I would like to understand from you that this was the part from the point of view of the donors, right? And what if someone is willing to is interested to get the stem cell transplantation, and are there any charges in between do they have to pay something outright to Datri or donate something or anything?
So for registration as a donor, like I said, we need to get our HLA report done, right? That HLA report, if you go out into the open market and you go to any lab in India and ask them how much it will cost, they will give you anything between 10,000 to 30,000. That is the cost per report. But because we are a registry and we are a not-for-profit, we have a reduced rate of 1,800 for every HLA that we get typed. So that is the cost that we incur when we register a donor, right? What we've realized over the last 12 years of existence is a lot of people will register with you because of peer pressure, right? Suppose we do a camp in your office, okay? You might be interested, but your neighbor is not. But he will or she will register just because you are doing it, just because all my friends are doing it. How can I not step up? Now, when this person is a match and they back off, okay, they decide not to donate, it's as bad as telling a hungry person that I'm sorry, the food is there, but I can't serve you. Finding a match is 1:10,000 to 1:1,000,000. So imagine if you are the only match and you decide not to do it, you're actually telling the patient that I'm sorry, I'm not saving you. So we've realized that in India, people will only give you money if they believe in the cause, right? We don't want to even give 10 rupees to a beggar unless we feel sorry for them in some form or shape, right? Why would you give Datri 1,800 for an HLA report which you don't want to use? Somewhere in the back of your mind, you're not convinced. So we ask the donors to give us 1,800 when they register as the cost of the HLA report. It's a way that we get donors who are genuine and who are willing to go that extra mile for a patient they're not related to. Okay? It is not hard and fast. There are people who will give you CSR funding as well. There are people who will fund you without, registering. But what we've realized is when we tell a donor, you have to pay, whether it's 100 rupees, 500, 900, 1800, anything, a lot of people will back off because they want to think about it. And it's good because if you're thinking at the point of registration, then when you're a match, you're definitely going to think. And we don't want to be in that position where, we tell a patient, yes, we have a match. And then we have to go back and say, we're sorry, but they decided not to. So 1,800 is what Datri charges for a registration. Okay. Again, like I said, it's not a hard and fast rule, but we do tell the donors that this is the cost that we incur. If you want to partner with us on it, then you let us know how much you're willing to pay.
Understood. And what about the patients? Do they have to pay?
So the patient has to incur a cost, because like I said, 1:10,000. So for us to find one match is 10,000 into 1,800. Okay. Right? I mean, I'm not saying exactly that is the cost that a patient has to bear, but before a donation happens, there's a lot of hard work and effort that goes into ensuring that the donor is fit to donate. So the donor will undergo a physical health checkup, which has some 50 plus tests on it. We don't want the donor to have any issues after the donation. We also don't want the patient to have any issues post the transplant. So I'll give you an example. Something simple like dengue. It can stay in your body and my body without impacting us as a lingering infection, right? But imagine giving it to somebody who's already fighting blood cancer. Okay. Luckily, COVID does not get transferred through blood, but pneumonia does. Okay. So if you have, or malaria does. Now, these are diseases or, issues that we face in our normal life without hampering us because we are healthy. But if you give this as one of the things that is in your blood stem cells when it goes to a patient, you're creating more fun for them when they're already suffering from, reduced immunity. They're already fighting something. So the donor has to undergo a health checkup. The donor may not be at the same location as the patient. So the product has to be transported, right? So a donor could be in Chennai, the patient is in Delhi. So the product has to be transported within 24 to 48 hours. Okay, so there is a lot of costing that gets involved in this. So there is a cost to the patient, right? But what we do is, in case the patient is in need, then we talk to the hospital and we will talk about how we can reduce those costs. But there is a cost involved.
Yes, understood. Thank you so much for shedding some light on that aspect as well. Now, we have delved deeper into these things, the nitty-gritties, that what is the cost and how does the entire process work, because I am really interested in these kind of things. And so now coming back to our agenda and the point of discussion today, the World Health Day. So discussing about health as a broader topic, what do you think? How can we prioritize health, and how will that improve the overall quality of us as a society, as a community, as a nation?
Wow. Covering a lot of ground. So, see, I will talk from two perspectives. Number one, as a donor. Okay, you can only donate if you're healthy. So if you're not healthy, then you can't donate, right? And like I said, finding a donor is difficult, right? Within your family, you will find only 25% of patients will find a match, right? Which means that if you have 5 siblings, you plus 4 others, you might have a match within your family. But how many people today have got 5 siblings? We're looking at nuclear families, right? So the chances of finding a match within the family reduces further. If a donor is not healthy, then we can't ask them to donate because they will have issues, they will face consequences post the donation. So you need to be healthy, not only for yourself, but for someone else that you can help in their hour of need. That's number one. Number two, with today's stress, the hard-paced life, COVID, not meeting up with people, and all those issues that we have, if you're not healthy, then you're not doing service to yourself. You need to be honest to yourself and say, is this the best I can do? And if it is not, then you need to change something to make it the best you can do. Right? Now, coming from a patient's perspective, if you look at the number of cancer cases that are being reported, Okay, I'm not saying that are occurring. I'm saying the number that is being reported is increasing. Right? If you think about 5 years ago, we all knew somebody distant who had cancer. Now we all know somebody in our immediate family who has cancer. So the incidences are increasing, right? Which means that there is some sort of care we need to take to ensure that if we are, or rather when we are a match, we should be able to step up and support. If you are not well, what kind of support will you give? So health is the only thing which is in your control. If you're not healthy, you're not being good to yourself, your family, or even the society. So focus on it. We're not saying go out and clean, the roads and the cities and make it a better place to live. We're just saying that you need to focus on what you're doing to yourself. The rest will follow.
That's so true. Thank you for again saying so inspirational lines back to back. And yes, so I think now Amrisha has some questions to ask to you, and over to Amrisha.
Hi Sumati. So before starting my question, I'd like to do my part of welcoming you. So welcome to Goodera. My question was, you said that the donors and the patients are reunited or given the information exchange happens only after a year. So is there a specific reason behind this?
Yes. So the first is, when someone is in need, okay, they will try everything to find out who it is. Right? If someone close to you is in need, is a patient, which I hope never happens, but like in Hindi they say Sam Dam Dand Bhed. You will try everything under the sun to find out who's the donor and get it done. Right? They can also be a financial, I don't want to use the term blackmail, but it is possible. See, the patient is already going through a lot of financial crisis. They're paying for their treatment, right? Now you find a donor who's relatively better financially. You can always reach out to them and say, you're a match for me. I don't know how you're related to me, but you're a match. Can you help me financially? Okay. It can happen the other way around as well. I am the only match. You need my stem cells. I can say the same thing to you. And we've had cases in the past where it has happened within families. So a patient in the US has a match in the family in India. The Indian family says, you're in the US, you're earning big dollars. Can you give me X amount? And for a patient's family at that point, they are willing to sell their life to give you what you want. Right? So they can be financial blackmail, they can be emotional blackmail. Okay, and these are not situations we want to get into. See, the donor and the patient come from varied backgrounds. You don't know what they're going through. You don't know how they're going to react. Okay, so after 1 year, plus once the bone marrow treatment is done, it takes about 1 year for the patient to be declared medically fit. So I don't want to give false hope to a donor after 6 months saying that the patient is doing well and then come back and say, no, I'm sorry, but the patient is still not okay. So we wait for 1 year. We get an approval from the treating doctor of the patient saying that they are fit to meet. And then we share their information if both parties are agreeable. Internationally, some registries keep it 3 years. Some registries say that they will not share details irrespective. So in India, we found that 1 year is a doable piece. And within 1 year, we generally come to know whether the patient is doing well, not doing well, what is happening. And for Indians, it is extremely important to know who they've given it to. I mean, I've done a good job, but I still need to see proof.
Absolutely correct. So have you seen any difference in donors' reaction? You like you said, you have been in this field for so long. So earlier, 10 years back, what were the questions that donor used to ask? Were they more reluctant than they are now, or now it's getting better? And if it's getting better, how better is it getting? And like it's a positive curve or a negative curve, or it's neutral?
So Amrisha, there are 2 points to here this answer. Number one is the metros. Okay, not exactly the metros, but I would call them tier 1 cities. Okay, we only have 5 metros, but we want to extend it to like the capitals of couple of the states. So there the situation has become better because obviously there is more information flow that is happening, plus there are more donors who have donated. So if you are a donor, I will get you to talk to somebody who's similar to you. Okay, or if I can find somebody within your community who's donated, or if I can even find somebody within your company who has donated. Okay, so that becomes a multiple layer of convincing people. See, when I talk to you, you will tell me, okay, this is all theory, but tell me someone who's donated. So if I can get you to talk to a donor, okay, similar in geography to you, young girl who's donated is living her life absolutely fine, she will convince you far better than I can do so, right? So in metro cities or tier 1 cities, the conviction has increased. The amount of time or effort we need to put in to convince a donor has actually gone down. We've also moved from meeting face to face to our donors to doing more of telephonic conversions. Okay, but the minute you step out of tier 1, because you will have to step out to get more of your donors registered, right? In tier 2 cities or in places where education is a bit of a problem, we still face the myths. We still face a problem where we have to convince the sarpanch of the village or the community. We have to get involved with either an influential person there, or we have to go through the doctor there, because they will not believe what we say. So if we go to a college, we prefer going through the faculty, because if your principal has said it, your professor is saying it, then you will do it. So these are things that we've learned, saying instead of just speaking to the donor direct, first check out who do we know in the sphere of control. Who are the influencers we can speak to first? Because if the influencer is talking to them, then they will listen to us far more easily than us just reaching out to them. See, registration is very simple. It's just a buccal swab. It's like a longish earbud put into your mouth, rubbed against your inner cheek, and that is the sample that is taken. It's not even blood draw that you remember, oh, I gave blood. So if you're a match after about a year or so, you may not even remember that you gave a buccal swab. So we have to start from there, right? Whereas if, like I said, in a college, if the faculty is talking to you, then you already know, yes, the faculty knows about it. This is, authentic. So tier 1 is definitely easier. Tier 2, we are still getting there.
You said it's finding out if a donor is a match or not. It's as easy as a buccal swab. So I also remember you mentioning a test's name costs around 10 to 30,000.
HLA testing, yes.
So what's the difference between these two?
So the buccal swab, you've got your blood count done ever? You've checked your hemoglobin?
Yes.
Yes? How does it happen?
They take the blood.
So you generally do a home sample pickup. Someone comes home, takes a sample of blood, and then you get the report, right? So you give a sample of your blood for getting to know your hemoglobin and the other things that come in the report. For HLA typing, we need a sample of your either blood or dead cells. The easiest way of reaching dead cells is the inner cheek. So we rub a buccal swab inside your cheek, which is good enough to get enough samples to be able to run the HLA report. So we just do a buccal swab, we get you to fill a form, we send that buccal swab to the lab, and we get your HLA report.
Got it. And what kind of complications can a donor face? Like you mentioned, the donor has to be of a particular standard health-wise to be able to donate, so that they don't face any kind of complications and consequences of this. So what are some of the things that they can face? And also, does Datri also keeps track of the donors and how they are doing in their health?
Yeah. So till now, donors don't face a consequence post donation, because if you are not eligible during medical checkup, you will not donate. Okay. So something like, let's say you have epilepsy. Okay. If you know your trigger, we will get an epilepsy clearance first. That we are not triggering it, because some people get epileptic attacks because of stress. Okay. A donation could be stressful for somebody. So, and a person who has epilepsy, even if it is random, it happens once in 3 years, 5 years, the chances are that person will not donate. Okay. If you take insulin through an injection for your diabetes, you will not be eligible to donate. Okay. If you've had dengue recently, you will not be eligible to donate for the next 6 months. Okay. Now, these are things which are not, for a normal human being, they're not fatal. But during donation, your blood sugar can go high and low. Okay. It's about a 4-hour procedure. We don't want to put you through something that can cause an issue, which is why medically you will be found to be ineligible. Which is also one of the reasons why a very thorough medical checkup is done. And if something is found to be even slightly out of sync, so let's say, your ECG is not straight, there's a little bit of a jump somewhere, we will get a heart clearance done to ensure that you do not have something which can get triggered, because while donation is very simple, we don't know how you react, right? The fact that I have to walk into a hospital could be stressful for me. So we don't want to trigger something, which is why the medical checkup becomes extremely important. We will get a clearance from the doctor who will meet you and also the patient's doctor. If both doctors are not in sync, the donor will not donate. Okay. Post donation, within a day, you're back to normal. So when you do a blood stem cell donation, like I said, it's between 3 to 4 hours. So you come in the morning around 10ish. We start the procedure. We finish by lunchtime. Datri will take you out for lunch. Okay. You go home. You're good to go wherever you want to. The only things we ask you to do is drink enough water. Okay. We found that just because it's going to be a 3-4 hour procedure, a lot of people don't drink enough water, thinking, how can I tell them I want to go to the washroom in between? So your body becomes a little dehydrated. Okay. It is better to drink enough water so that you don't have, the normal consequences of dehydration, which could be a headache, could be a bit of nausea. So drink enough water. We prefer if you don't do something strenuous for the next 1 or 2 days. So please don't go to the gym. Go to the gym after 3 days. Okay. These are normal things that you are also told when you do blood donation. So from a blood stem cell donation point of view, the donor does not need to change his or her habits. Just needs to take half a day off. If you want, you can even go back to work in the second half. And to answer your second question, yes, Datri does stay in touch with the donors. So we have a follow-up call on day 2 post-donation, just to find out how they're doing. Then we have a call 1 week later. We have a call 15 days later to take feedback on how the whole process went, if they had any improvements they'd like to suggest. 1 month post-donation, we do a complete blood count for them, just to ensure that they are assured that their body is back to normal. We can do it on day 2 as well. But the way Indians think, you've taken my blood sample today, you're giving me a report 2 days from now, you've taken the same sample and you're giving me a report. So we are saying we wait for 1 month and then we will do a complete blood count. We stay in touch with you till 1 year and then annually. We also share all our newsletters, our information, etc. with the donors. They're part of the family now. So they can reach us, we can reach them.
That sounds amazing, and I am very sure Datri is like a God's gift for all the patients out there. So I want to ask you, like, listening to all the great work that you guys have been doing, what is the end goal? Like, what is Datri's goal for that will tell us that yes, we have achieved something?
Our end goal is to ensure that everybody who needs a donor has the potential to find a donor. And right now we have more than 2,000 patients registered with us who don't have a match. We have more than 4.7 lakh donors registered with us. But even then, we have more than 2,000 patients who don't have a match. So our end goal is to ensure that everybody who's looking for a match finds at least one.
So in average, how long a patient has to wait for a donor?
There is no timeline, Amrisha. We've recently given a product where the patient waited for 6 years, but they had a benign condition called thalassemia. So the patient can survive with frequent blood transfusions. There are some which are faster moving cancers, the patients don't survive. So there is no standard time limit as such.
Got it. And how frequently can a donor donate? I guess it's once in a lifetime.
So we say twice in a lifetime. So after you donate, you become deactive in the registry for 1 year. Okay. Post 1 year, we check with you whether you'd like to donate again and would you like to be reactivated. You can donate to 2 different patients. If you're still a match for a 3rd patient, which hasn't happened till now, but that will be taken on a case-to-case basis. But we said two different patients.
Okay, understood. So I guess so far it has been such a wonderful, insightful conversation with you, Sumati. And you have been very, very patient with our questions. We have been throwing questions so frequently and so randomly to you, but you have been very patient and very informative at the same time. So thank you so much for being so patient with us and answering to all our questions. I guess we have this last question with us. And we wanted to touch up the another aspect in a non-profit organization, let's say in any non-profit organization, which is volunteers. Like you have talked a lot about donors, a lot about volunteers as well, and the non-profits that we have talked to earlier as well, they have also said that when it comes to the most important stakeholder of a non-profit organization, it has to be the volunteers. Because without the support of people and people with the right intent to support the cause, a non-profit or a cause cannot be furthered with just a vision and a mission of an organization or a person. So I would like to understand more about how can someone support your non-profit organization. Let's say I am sitting in a completely different part of the world, and I want to actively support the cause. I want to support your non-profit organization. Are there several ways, virtual or physical maybe?
So Pratham, the first thing, like I said, the more people who register, the better for us. So spread the knowledge, get people to register. You just need to be between 18 to 50 years of age to register. You need to be healthy, right? So if you're between 18 to 50 and you're healthy, then you should not think twice before registering. You don't know when you could be a match for someone in need. So irrespective of where you're sitting, that is the first thing I would urge every volunteer to do. Okay, spread the message, because believe me, when you talk to even your colleagues, I'm sure they will not understand or even know what is blood stem cell donation all about. Okay, we've all heard about bone marrow, we've heard about bone marrow transplants, but we don't understand how we can help. So the first is, like I said, create awareness. Okay, get people interested, and if they're interested, then get them to register. You can register online as well. Thanks to COVID, I think we've moved more to a virtual world. So there is a join now link on our website. You can go there, put in your details. We will send the swab kit to you. You swab and send it back. Okay. If you have multiple people, okay, let's say you have a group of 10, 12, 15, 20 people together, we can also do a Zoom call and walk you through how it works and answer any questions that you might have. Okay. Number 2 is, like any non-profit, money is always an issue with us. Okay. So finding people who will sponsor other donors is also a way you can assist. Okay. We don't have any minimum cap saying this is the minimum you should give, but 1,800 is what we incur as a cost. So you can give $100, 500, 1,000, 1,800, multiples of that is up to you. Okay, so that is a second way that you can definitely assist a non-profit like Datri. Okay, the third would be if you can give us contacts of people you want us to approach. Okay, we all have our spheres of influence. We all know people whom we may not be willing to approach, but if I give it to somebody else, maybe they can make a pitch and it works. You can do the initial, we will follow through. Okay, so those things definitely help. The third I would say is, if you are technically inclined, if you think you can help us with an online campaign or something like that, okay, the more people who think about it, I think the better campaigns can be defined. Okay, for you and Amrisha, I would also say that because you're dealing with non-profits, okay, you probably have got success stories that have worked elsewhere. Share those with us. Maybe we haven't thought of those. Okay. During COVID, I think a lot of people have had to move, a change of pace. I mean, before COVID, we didn't even think we could do online sessions. We always did face-to-face sessions. Now we're doing online sessions. Okay, we didn't know we could convince donors on the phone. We always thought that our volunteer or our employee had to go and meet the donor and then explain to them. Now we're doing more of phone counseling. Okay, and you can also help us in doing our work in the area you are located. So if we need a volunteer to go meet a donor to collect a sample from them for a medical checkup or something, then volunteers would definitely help. It would cut not only our cost of an employee traveling there, but it also shows the donor that there are multiple people in the whole chain. So there is higher acceptance, right? And we've realized that volunteers are very crucial. We can't reach out. I mean, it's each one teach one, right? So if you don't have 100 volunteers reaching out, then those are 100 hands that you don't have. So volunteers are definitely very, very important for us. And I would say that once you understand what Datri does, then you should tell us what you want to do with us. Don't wait for Datri to come back and say, this is a campaign we'd like to run with you. You tell us, you are the masters of your sphere. So you should come back and tell us, look, why don't we try this?
Absolutely. I think I totally agree with your last point that if you will have the right intent to support a particular cause, then you will find your way, howsoever you want to. And yes, then I think the non-profit is just a medium, and the volunteer can solely take it away from there. So thank you so much, Sumati, for answering all the questions, clearing our doubts so thoroughly. and sharing so many insights. I think those were all our questions. And if you have anything else to share with us, please feel free.